Although the popularity of aesthetic treatments in men have gained some traction, I think the majority of men are still wary about having anything done to their faces. So I have asked one of my patients, a 40-year-old athlete, to share his aesthetic journey with us. As with any medical procedure, there's a system that we need to follow. Firstly, we need to make a diagnosis of what is causing the symptoms of aging in the face. We need to understand the underlying anatomical changes that has happened, whether it's bony or some of the overlying supportive tissue. Once we understand that, we can take a look at the properties of our product in order to plan a decent treatment protocol. We're going to take a look at Werner over the next couple of weeks to see what we have done for him. As we have highlighted in the video, we have identified the underlying causes, and now we can take a look at our product ranges, their unique properties, to plan which product we're going to use and where we're going to put it to give him a good aesthetic outcome. I have Werner back in the office today, and we're going to continue with his aesthetic journey. In our first session, we focused on quality of skin, and we used the collagen biostimulator Sculptra. Werner, it's been 4 weeks since we've done your Sculptra treatment. What are your thoughts?
Yeah, I definitely see a better quality in the skin. The elasticity of my skin is a lot tighter, and I'm actually seeing a lot less bags and wrinkles on my face.
Okay. One of the things that we need to understand with the collagen biostimulators, they really do take time to work. Werner is actually now only starting to see the production of collagen, and over the next couple of months, this will get better and speed up. Today, we're going to focus on creating bony support and more structure in the face. I'm going to use tissue fillers in the Restylane range, and let's quickly take a look at where I'm going to put them. If we look at a full frontal view of Werner's face, we can see that there's slight asymmetry in the bony structure, and this is clearly seen in the angle of the jaw between the left and right sides. So I'm going to compensate for that asymmetry by using a filler that will enhance projection like there was bone. So we'll be working for him in the mid-face where there's still severe volume loss. And then I'm also going to work on the zygoma to give him a little bit more definition as well as projection in that area, masculinizing the face, not feminizing it. There's loss of definition here in the angle of the jaw, especially in that area. And when we broaden that and accentuate it, it's going to improve the appearance of the jawline as well as square out the face, something that's really important for a handsome man. So before I start volumizing, I'm going to work on a little bit of structure. So what I'm doing is creating some support and projection here in front of the ear. This is going to help me to square out the face. Okay, if I can get through here. Placing some filler in front of the ear gives us more definition to the angle of the jaw, as well as support the tissue, pulling it back and defining the rest of the jawline. Okay, Werner, was that painful?
Not at all.
Okay, now I'm going to sit you up and we're going to start working on volume. So in the Galderma range, we have two different technologies. Now, the technology that I am using now is called optimal balance technology. And it's a soft filler that gives us volume and integrates with the underlying tissue. So a very natural volumization. We never want to over-volumize the male face, as it will feminize it and create a soft look instead of a more angular appearance. So I've just given Vanna a little bit of softness. We're going to square that out now. We can see by revolumizing the mid-face area, as well as strengthening and squaring out the jaw, we have a nice masculine look. We have volumized the mid-face for you slightly, and you can see that it's just taken that sunken look away.
Definitely.
Now I'm going to create structure by using a different filler. Putting filler along the jawline not only supports the tissue in the front, pulling it back, but also allows us to create a far more angular and defined angle to the jaw. So I've done the one side of the face, in my opinion, the more difficult side, because we had to create more projection. So Vanna, sit up, let's take a look at what we've managed. So we can clearly see that there's more definition and volume in the mid-face if we compare it to the other side. We've worked in front of the ear to create support and pull this tissue, and then we've created a stronger jawline. And I think on this angle we can clearly see a far more defined angle at the jaw. So in our next treatment with the biostimulator, we'll work a little bit more here to create more pull along the jawline, strengthening it even more. I think we can all see that there is improved volume as well as angularity in the face. We haven't feminized him. So as you can see, it's a fairly quick procedure. And if you understand the underlying condition, the dynamics of the face, the properties of a product that you are going to use, and then place it correctly, you get a very natural look. And this will last for up to 18 months. Your experience so far?
Yeah, it's been a really cool journey, and I was a little bit nervous, but yeah, excited now because I'm seeing good results.
Okay. Follow us as we continue with Vanna's aesthetic journey. We're going to do another polyalactic acid sculpture treatment for him to further improve quality of the skin, address the sagging as well as the laxity that's still there, and then we're going to finish it off with the last filler treatment in about 2 months' time.